Okay, I'm ready. Hello, my name is Crystal. I'm going to be the nurse assisting you today. Can I have your name and date of birth, please? Thank you. I'm going to verify your name, Dan. Thank you. Today we are going to do a physical assessment. This basically gives us just a general overall health, how you're doing, and that way we can base any kind of nursing practices off that. Do you know the dates and where you're at? Wonderful. And why are you here? Okay. I'm going to move this out of the way. And I would do privacy if there was a curtain. Okay, Mr. Smith, we're just going to do a head-to-toe assessment, starting at the head and going to the feet. If you have any pain or discomfort, just let me know. I am assessing the skin as I go head to toe, color, moisture, dryness, also the trigger. In an elderly or older adult, I would test it in the chest. So it's kind of hard to know that I'm doing that, but I am assessing the skin as I go down. Okay, so at the head, I would check for any kind of hair deviations, lice, any lesions on the head, bruising, any sore spots. Mr. Smith, do you have any headaches or any kind of head trauma that you've had? If he says no, I would move on. I look at the face, make sure it's symmetrical. Mr. Smith, do you have any hearing or vision problems? Any hearing aids or glasses? And how about any dentures? Okay. To be able to assess the ears in an adult, I would pull up and back. In a child, I would pull down and back. Assess the ear canals. And then I would go ahead and check his vision. His vision is tested in the field of vision. So, Mr. Smith, I just need you to hold your head stationary and just follow my pen with your eyes. Good. And the other side? Wonderful. And it's going to come close. Just watch it. Thank you. The next thing we're going to assess with your eyes is just to make sure that your pupils are reactive to light. So again, just just look straight at me. Okay. Wonderful, thank you. I'm going to go ahead and assess your nose. So just breathe normally. Have you had any nose trauma or facial surgeries? Good, okay. And we're going to just check your mouth. Go ahead and open and say ah. When looking in the mouth, we're just going to make sure that the coloration is pink, it's moist, there's no lesions, all the teeth look healthy and no abscess. Do you have dentures? Okay. Usually if I would check their gait also, but with a patient that is immobile like Mr. Sim, the range of motion would be a little bit different just because he has a different kind of disease that he can't get up, and I've been told he's heavy, so I'm not going to pick him up. Range of motion, if they were sitting in a chair on the side of the bed, you would assess any of them getting up, any kind of spinal cord deviation or curvature. Also, if they were balanced and if they walked evenly without imbalance problems. Mr. Smith, I'm going to go ahead and raise the head of the bed just a little bit. Oh my. Let's see if I hit the right button here. Oh, there we go. Okay. Okay, Mr. Smith, I'm going to press against your shoulders. I just need you to press back. We are just making sure that you have a good range of motions in your shoulders. And the neck, I'm also going to check if you have any lymph nodes that are swollen or sore. Have you had any problems with irritation or any kind of pain? Wonderful. Bottom of the chin, down the neck, anterior of the neck, across the clavicle. And you didn't feel any kind of pain with that? Good. Okay. I'm going to assess the skin on your arms. Capillary refills in the fingers. Okay. No bruising. Okay. Mr. Smith, I'm going to go ahead and listen to your heart. I will listen for the aorta on the second intercostal on the right, second intercostal on the left, pulmonic. Third intercostal is going to be Erb's point. Fourth intercostal will be tricuspid, and mitral is going to be on the fifth and to the side. I'm going to just put it under your chest. Okay. And other side. Okay. I would usually pull it further, and I'm going to be listening on the inside. I just don't want to pull it awkwardly, but okay, sounds good. I'm going to go ahead and listen to your breath sounds, Mr. Smith. Just breathe normally. I would also do the anterior and posterior. Since he's laying down, I think I'll just lift him up. So I'm going to do the anterior lung sounds. And again, I would do it underneath the gown. I just don't want to unhook it. But yes, I do it underneath the gown. Deep breath. Deep breath. Lung cells on the front is 1 through 7, doing a specific pattern, and then 8 and 9 is towards the side. On the back, it's the same kind of pattern. Make sure not to go over the bony structures of the scapular, so it's going to be more of a curvature. Once you get towards the bottom, you want them to ask to take a deep breath so you can hear the bottoms of the lungs more clearly. Okay. Mr. Smith, we're now going to go ahead and assess your abdomen. Do you have any pain or problems with appetite? Okay, and when was your left bowel movement? Good, okay. I'm going to go ahead and lay the head of the bed down. Is that comfortable for you? Good, okay. I'm going to go ahead and assess your bowel sounds. I'm just going to listen in all 4 quadrants just to make sure that I hear bowel sounds. Okay, wonderful. And you haven't had any pain or discomfort when you do have a bowel movement? And when was your last bowel movement? Wonderful. Okay. I'm going to go ahead and assess your legs and make sure that there's no swelling. Have you had any pain in them? Wonderful. All right. As I assess the skin and up and down the body, I'm also checking for any kind of distal pulses. So my radial, my brachial. We usually don't check for moral, typically, unless it's warranted. But I'm also going to be checking for pedal pulses, just to make sure your circulation is good. And again, the circulation response. Okay? And there's no pitting edema, there's no pain. All right, Mr. Smith. I am going to push down on your feet. I just need you to push against me. Good. Good. I'm assessing the heels for any kind of skin breakdown. That is a pressure point along with the elbows. That pressure ulcers are very common. Okay. Assessing his range of motion is a little bit more difficult when it's in bed. Depending on the disease or the paralysis, arm flexion, being able to stretch above your head, and then also legs if it's not a paralysis type disease. Okay, Mr. Smith, I think I have everything I need. I'm going to go ahead and set up the bed for you. If I can do it, I guess. There we go. All right, is that comfortable for you? Wonderful. All right. After doing a physical assessment, always do hand hygiene. Again, my name is Crystal. If you have any questions or concerns, please let me know. I'm going to die of a heart attack. What? I'm going to die of a heart attack.